Well, today we're going to talk about how to allocate hospital staff for an upcoming influenza season. Some of our business requirements is we need to provide information to support a staffing plan, detailing what data can help inform the timing and spatial distribution of medical personnel throughout the United States. We also need to determine whether influenza occurs seasonally or throughout the entire year. We got to prioritize states with large vulnerable populations, as well as assess data limitations that may prevent us from conducting the desired analysis. A little bit of a project motivation here is the United States has an influenza season where more people than usual suffer from the flu. Some people, particularly those in vulnerable populations, develop serious complications and end up in the hospital. Hospitals and clinics need additional staff to adequately treat these extra patients. The medical staffing agency provides this temporary staff. And last but not least is our project objective is to determine when to send staff and how many to each date. So the first thing that I wanted to look at is basically the number of hospitalizations, which I believe will give us a very big trend as far as which areas have most uh, people coming over, so that we can make sure that prioritize those areas with more uh, people coming in into these specific hospitals. As you can see right off the bat, this is our graph for the US map of average influenza deaths and hospitalizations for 2010 to 2016. Um, you can see that essentially the darker the state means the more the average hospitalization per year, and the bigger the circles mark the average deaths, right? So there is definitely a common trend right there that exists, both of which I think are very important to determine and pinpoint where's our highest concentration of people that need most hospitals will be. Right off the bat, you can see that New York has the highest one with average deaths per year, 9,292,000, and the average hospitalizations at 4,972,468 patients per year. Second place, we can see California as well. It's at 12,000 and a million, 0.5. And then we got Virginia and so on, right? But this will give us a little bit of an insight as far as where our most um, hospitalizations exist. Of course, in this chart on the right, we can see that our top states are New York, right? And Virginia, then Illinois, Texas, and so on. But we can allocate more folks depending on where on this ranking they are. The next piece of data, which I thought was very important, is to look at the death rates, because a lot of the deaths, these deaths are related specifically for influenza, of course. And of course, this allows us to see the age groups per death rates, which kind of helps us to zoom in on which age groups are most vulnerable to getting sick and essentially dying, right? Ultimately, hopefully not. But as we can see here, I've broken down each death by bins. Um, and for every bin that we have here, right, from the rate from 10 to 15, 10 to 20, you can see that the 85-year-old age group beats all of them. So they are indeed the most vulnerable population. Not only that, do we know that from this chart, but from this chart, we also know which states have the highest, have the highest deaths, right? As we can see, California is on top. Then we have New York, Texas, and so on. So knowing the deaths by state and per age group allows us to allocate which states essentially have these vulnerable populations, which we can zoom in and make sure that we pay extra attention to try to send more staff. Lastly, we have our conclusion, and we can see a high relationship between the at-risk population and the hospitalizations, right? The higher the risk population, the higher the hospitalization. So of course, these states are very important that we take very close attention to, because they're at a higher likelihood to get more hospitalizations and more staff. Essentially, given the percentage data, we can observe that the higher rates of hospitalizations and death in high-risk populations. um, so very, very important. Looking at all this, we have to prioritize those states that, again, do have the highest death rates with, of course, the higher amount of uh, the higher age groups, as well as the higher amount of hospitalizations, both of which I believe are key important notes uh, for us to allocate. Now, some limitations that we do have is uh, we need to know the amount of staff needed per patient, right? And I guess that would depend as well as what type of influenza type we have, as well as we need to know how many staff members we have in total to distribute. If we have those numbers, then we can come up with a good algorithm to try to define which states would need a little bit more and which ones a little bit less. But for sure, the hospitalization and deaths would be our top factors in knowing where to send each. Now, how would we monitor the impact of our staffing changes? We would have to measure, I believe, by patient lobby wait time. Of course, a long lobby wait time would mean that the staffing agency is not as capable of handling patients, and a shorter one would mean that they are capable of handling the people coming in, right? So very important that we will have to monitor this, of course, um, per day, I would guess, and then we can compare the charts to see where we can allocate more staff to each place. But thank you for watching my presentation. I hope this helps you and helps you to be ready. Stay safe.